I'm just waiting for some people to get online for this live. So I'm going to talk about what are the functions of pelvic floor. Why is it important? Because last time I talked about what is pelvic floor. First of all, we have to know what it is before we can figure out the benefits or problems that it can have. So I want to address what are the functions and why is it important, and then what are the most common problems it can have. Okay, so last time I explained that this is pelvis and it has all the organs inside, and the rectum fell down. But anyway, so this is pelvis, this is pelvic floor, these red muscles, all the big ball, and those are pelvic floor muscles. In last video I explained what pelvic floor muscles are and why they are important, and I'm just going to quickly review. So our bladder, bowel, and uterus, and all the ovaries and the reproductive system, they are all inside the pelvic cavity, and pelvic floor muscles are what's supporting them, and that's why the pelvic floor muscles play a key role in our bowel function, bladder function, sexual function, and carrying and delivering the baby, for females especially. So the main functions are for pelvic floor, or the main functions that pelvic floor supports and has a role to play in are peeing, pooping, sexual activities, and delivering the baby. And pelvic floor plays a role, and it actually is an active part of all these activities. And when there is a neurological dysfunction where your nervous system is not controlling the pelvic floor the way it should, or it's not sending the signal to the brain, or it's not receiving the signal from the brain the way it should, the pelvic floor muscles are not functioning the way in an optimal situation, and they're not helping you with the function. And there could be muscular problem. The muscle may have been damaged or injured during a fracture or car accident or a fall. I have had patient who fell from like some really high height and she fractured her pelvis, and then she started having severe pelvic pain, and that was leading to a lot of other problems. So it could be sexual trauma, it could be delivering a baby, a cut that they have to do, episiotomy tear. There are so many things that can interfere with the nervous system as well as muscle function and how the muscle operates. So this is where sometimes something goes wrong and the pelvic floor is not doing its job. So what are the problems that it can cause if it's not functioning the way it should function? So it can lead to urinary leakage. A lot of people can have leakage when they laugh, cough, sneeze, or pick up something heavy, or pick up their kids, or running, any sports activity, dancing, jumping. If somebody's leaking with daily simple activities, any activity period, like there are people who never leak. Even if their bladder is full, they don't leak. There are even 90-year-old people who never leak. So you can't blame it on your age. You can't blame it on your genetics. Just because your mom was leaking doesn't mean you should be leaking. These are muscular problems, and this can have something going on with your nerves that are supplying the muscle, and we can treat it. So urinary leakage, urinary retention, not being able to fully empty the bladder, and some women will come and complain to me that I don't have any problem with leakage, but even after I go use the restroom, I feel like my bladder is still not fully empty. So that's a different kind of problem. Then leakage has multiple types too. There is stress incontinence, where you leak with coughing, laughing, sneezing. There is some physical activity that's causing stress on your pelvic floor and then you leak. So that's called stress incontinence. There is urge incontinence, where you get sudden urge to go pee, and most normal people who don't have pelvic floor problem, if they get the urge, they can still hold it for 20 minutes, half hour, or longer based on their capacity of holding it. But there are people who have to go rush to the restroom right away, or they know they have to go within 10 minutes, otherwise they're going to start leaking. So that's called urge incontinence. You get the urge, you can't control it after that, and you have to really make it to the restroom very quickly. Then there is mixed incontinence. That basically means you have stress incontinence. So you cough, laugh, sneeze, run, pick up babies, you leak, doing those activities, or you also leak when you get the urge. So you can't even hold it once you get the urge, and you leak whenever throughout the day. So these are three main types of incontinence. There is another type of incontinence that's called giggle incontinence. That's common in young girls, teenage girls. They could be giggling and they could have urine leakage. And I've had patients where they would fully soil their clothes as teenagers, and they remember doing that. And it's not fun. It's embarrassing for a lot of times. Nobody wants to be in that situation. So that's a sign that a young teenage girl or whoever is, when they're giggling and they are laughing and they are leaking, they could have some pelvic floor problem going on. So these are the bladder issues that can happen: urgency, frequency. Some people have to go pee frequently. They go every half hour, go every 20 minutes. Ideally, an adult or anybody with full full bladder control, but let's talk about adults. An adult should be able to hold urine for 2 to 4 hours, 3 to 4 hours. So if it's anything less than 3 hours, if you're going pee, if you have to go pee, use the restroom every 1 hour, 1.5 hours, that's not normal. I've had patients come and tell me they have a small bladder, their dad had a small bladder, or their mom had the small bladder because they saw the parent going to the restroom frequently. They just thought it's a small bladder. Or it's genetic. It's not genetic. You more than likely you don't have small bladder unless somebody did some ultrasound testing and the urologist or urogynecologist told you that. That's a different story, but most of the time it's a behavioral thing. It's pelvic floor that's not controlling your bladder function properly, and that's why you're going peeing frequently. So just remember, you can't blame your bladder when there is something wrong with your pelvic floor, and we can easily treat it. You just need to learn what's going on and how you can do certain things at home to improve the control of your pelvic floor. And generally those are long-lasting changes once you learn how to do it correctly. The other problem so the other function pelvic floor has is the sexual function, penetration, and a lot of people have pain with sex. And last time in the video I explained how this layer can have this is a muscle layer, and it basically wraps around your birth canal, and that's where a lot of times there could be spasm, or there could be some nerve irritation, or there could be some an episiotomy or tearing that happened during birthing process, and the scar is very sensitive, and that's causing constant pain. And if it's not elastic enough, that can lead to a lot of pain during penetration or gynecological examination or inserting tampons. And that's where we need to look at what's going on with these muscles, because it's a muscular problem. It's not in your head. Listen to your body. I actually just did a workshop or kind of mommy mixer for one of the private groups, and that's what I told these moms, that because some of the moms had been to two gynecologists who told them there was nothing wrong with them, and then they went to third one and the gynecologist was able to diagnose that she has an organ prolapsing or something else is wrong. And don't allow your medical provider to tell you otherwise. If you feel that there is something wrong with your body, go get second opinion, third opinion, because you know your body the best. And if you constantly feel there is something wrong, you just haven't found the answer, and you haven't found the right provider who is trained enough to know what's wrong with you. So know that your body will tell you if something is wrong, but pain with sex, any kind of penetration, is not normal, and we need to look at what's going on. There are people who have pain with deeper penetration, so they don't have pain initially, but they have deeper pain, and there could be something going on with this layer, and we need to look at what's going on there. So this could and this pain could be related to delivering baby or being having pregnancy, having gone through pregnancy, or it can be not related at all. It can even happen before you ever had child. So just remember, any pain is not normal pain, and we need to look at what's going on. The third function is bowel control. So pelvic floor helps in controlling the bowel leakage. We don't, like most people, once babies have full control, kids have full control of their bowel and bladder, they don't necessarily leak anywhere. They know they can control it, and they can wait until we reach the destination, and then they can go use the restroom. So even kids can have full bladder and bowel control. So as an adult, nobody should be leaking bowel or urine either way. So if there is some leakage, if it's especially related to pregnancy, delivering the baby, there could be some damage that happened to the pelvic floor muscle. What's going on with your anal sphincter? We have to look at those things, because that's what helps in controlling bowel movement. And there are people who are, during the bowel movement, when they go to the restroom, they are straining and they're pushing down to try to empty the bowel, and sometimes that leads to dysfunction, especially if they have had chronic constipation. So it can go both ways. Pelvic floor can be not functioning properly and lead to chronic constipation, or chronic constipation can also lead to dysfunctional pelvic floor. So if somebody is doing all the right things in terms of eating, drinking more water, managing their stress, breathing, all the things that you do to improve your health and have healthier bowel movement and gut health, and you're still getting chronically constipated, there could be a chance that your pelvic floor is contributing towards your constipation. And I have had patients where we treat their pelvic floor and they are not constipated anymore. So just keep in mind that could be one factor. I'm not saying every person with constipation has pelvic floor problem, but that's something that can play a role, especially if it started around pregnancy or postpartum, after delivering the baby, or if it starts around menopause. So if you were never constipated before and now suddenly around your menopause something is going on, we can look into it and kind of diagnose if the pelvic floor has anything going on with it. So bowel, bladder, and sexual function are what controlled by pelvic floor, but there is another thing that pelvic floor controls and helps in keeping things aligned. So we have bowel, bladder, and uterus inside, and there is an opening here. So these organs can actually fall into the opening. So a lot of women after postpartum or during delivery, if they had a really traumatic delivery, if they had to push really hard, if the baby came out very quickly, sometimes that could also mean there was a lot of force, and that can lead to organ prolapse into the birth canal, and that could become a major problem eventually. It can lead to some urinary leakage if you have a prolapse that's not being treated properly. People can feel a lot of heaviness in their vagina. There could be just feeling of not feeling right, constipation, not being able to fully empty your bladder or not being able to fully empty your bowel. All of these could be sign of organ prolapse. Some people can even see their organ prolapsing into the opening when all the time, or when they are peeing or pooping, and that's also a sign you could have organ prolapse. Your gynecologist and your pelvic floor women's health physical therapist can diagnose that. So make sure, if you're not sure and if you're suspecting it, reach out to your doctor, the right provider. And some women don't get it immediately after babies. A lot of times this is a support dysfunction. That means the fascia and the pelvic floor are not supporting your organs properly, and sometimes it takes actually few years or multiple years before you have bad enough symptoms. So this could be something that's happening for years and you feel nothing at all. So ideally every woman after every single pregnancy should get pelvic floor evaluated. But if you have had kids years ago and you never knew about this, you can still do it as a prevention and at least get it checked. And OBGYNs can evaluate your pelvic floor, but their evaluation is still very gynecological oriented. They are not evaluating your pelvic floor muscles, ligaments, nerves, and all those things. So pelvic floor physical therapist does a different evaluation than the gynecologist. So just know the difference. So the prolapse, the easiest way I can explain prolapse is this. If you look at this chicken and if I press on its tummy, see what happens? That's called prolapse. That's because that's where the opening is, and that's the easiest way organs can come out of the body, and the gravity is constantly acting on it. And I have had patients where within few sessions their prolapse actually improved. They were seeing the prolapse sitting at the opening, and then now they're not seeing it anymore. And we keep working on it. Not everybody can have that improvement, so it really depends on case by case. Basically, we'll have to see what's going on with you, but everybody can have some level of improvement. But if you don't do anything about it and you just wait for it to get better or wait for your life to slow down, your body is not going to wait for your life to slow down or for you to have time to make, or for your finances to be right steady for you to take care of your health. So if you don't even get evaluated, you don't know how bad it is, and then few years down the road, if there is somebody evaluates you, they don't know what happened between first year and fifth year. So if you had evaluation done first year and there was nothing, and then at third or fourth year, if you go see doctor and they see something, at least we can catch it early on, and the sooner you get treated, the better the outcomes are. But anytime is better late than never. Like, just not doing anything about it is going to lead to a point where it's so bad that they'll have to do a bladder lift or uterus lift or remove the uterus based on what is prolapsing and how bad it is. So I would like every woman to know that there are treatments available before they get so bad that they need these extensive surgeries with so many side effects and risk factors. So if you are suspecting you have prolapse, you already know your doctor told you have prolapse, pelvic floor physical therapy can help. And a lot of times abdominal muscle separation, nobody thinks about abdomen as part of pelvis, but if you look at this pelvis, the abdominal muscles are here, they're very close to your pelvic floor, and they maintain the intra-abdominal pressure and the pressure going down to your pelvis. So they can play a role. Not properly functioning abdominal muscles or the coordination between your pelvic muscles and abdominal muscles can interfere with how the pressure is being loaded onto pelvic floor, and that can also lead to pelvic floor organ prolapse. So the uterus or the bladder or something can prolapse into the birth canal. And assessing for abdominal muscle separation after pregnancy can really help to take preventive action. If somebody has the separation that did not heal completely, pelvic floor physical therapy can help, and that can in turn help your pelvic floor, because now your abdominals are doing their job and they are not loading your pelvic floor too much, and you're avoiding the risk of leading to prolapse a few years down the road. And so it doesn't have to be direct trauma. It can sometimes be weakness or deficiency somewhere else that leads to complexity and complex problems in another area. So abdominal muscle separation needs to be addressed and treated, because it can lead to chronic back pain, sciatica, other pelvic floor problems, and it's not going to get better on its own if it didn't heal. And a lot of people try to do crunches and planks and all these online workshops and online seminars offered by different coaches. They are good. I'm sure they are good workshops and seminars and classes, but they are for people who don't have existing problem. If somebody has diastasis recti, muscle separated, and the deeper layers are not engaging, doing crunches is only going to make it worse. So we are not saying don't do crunches, but know when is it safe to do crunches. Are you even ready for it? Do you have the right muscle activation to be able to do crunches or heavy lifting or heavy job duties? So ideally, every woman should get evaluated after every single pregnancy. If you have had babies years ago, you can still get evaluated. You can choose that option for your preventative treatment, the way you go to your physician for full body checkup and make sure your cholesterol and blood pressure and everything is in check, because you're not going to wait for you to have high blood pressure and have some complication from it and then treat high blood pressure. Some people do that, but a lot of people with insurance is offering well visits every year. We go and do health checkup every year for overall body function. Then at least the pelvic floor needs to be addressed if you have had babies, or if you have one of the complaints I talked about, urine leakage, bowel leakage or constipation, bladder retention, difficulty emptying the bladder fully, difficulty emptying the bowel fully, any kind of sexual pain or dysfunction, and prolapse. So these are just most common problems that I'm talking about. There are a lot of other things that we can address, but they're not as common, or they're generally mixed symptoms along with these major symptoms. So then we see all these other problems with the urine leakage or with the prolapse, and we'll address those. But most of the patients generally come to us with these major complaints, and then we figure out what other things are still being affected that can contribute to the major problem, and we take care of all of that so you don't regress back in 6 months to the way you were before. So I think I did go longer than I intended initially, but I hope that was helpful and informative. And if you think somebody you know might be suffering from it, a lot of your moms are at an age where they might be having all these problems. Women going through menopause and postmenopausal women have hormone imbalance, and that can also lead to tissue quality changing and lead to prolapse or pain with sex because of the hormonal changes, and a lot of those things could be treated with pelvic floor treatment. So if you have any questions for me, please type into the chat. I would love to answer those. And if you don't feel comfortable posting it here, feel free to reach out to me at 214-210-0715. You can call me or text me. Please write your name and who you are and what your problem is, so then I know this is a patient and I should respond back, because there are a lot of spam calls that I get and I may not respond to all the calls, but I would love to answer any questions and guide you in the right direction. And you can find all my contact information on my website, www.activebodyactivelife.com. Talk to you later. Bye.